This is a research about intra and pretumoral radiomics based on dynamic contrast enhanced MRI to identify lymph node metastasis and prognosis in intrahepatic cholangiocarcinoma. Intrahepatic cholangiocarcinoma is the second most common primary liver malignancy and has a poor prognosis that could be influenced by lymph node metastasis. And lymph node metastasis is primarily established on lymphadenectomy, as preoperative imaging have limited diagnostic accuracy. Radiomics has been proposed as a promising method for non-invasive elevation of lymph node metastasis in several tumors, including iCCA. But previous studies have only focused on the features from intratumoral areas, and they ignore the potential predictive value from pre-tumoral regions. Thus, we aimed to develop and validate a Radiomics nomogram integrating intra and pre-tumoral features for identifying lymph node metastasis and prognosis in patients with iCCA. 153 patients were retrospectively collected from an 8-year window to build the model. 107 patients from Zhongshan Hospital were included in the training set with an internal test set of 46 patients, and 51 patients from First Affiliate Hospital of Wenzhou Medical University were included as an external test set. We collected clinical and pathological data from medical records of both institutions. Pathological lymph node metastasis was defined as the presence of tumor cells in at least one lymph node. All our patients underwent preoperative MRI examinations. The sequences included T1 and T2 weighted imaging, diffusion-weighted imaging, and the dynamic contrast enhanced imaging. 3 radiologists were blinded and independently reviewed the images to determine the following 10 features, including tumor size, Peng, signal intensity on T1 and T2 weighted imaging, target site on DWI images, ring enhancement on arterial phase, enhancement patterns, intrahepatic dilatation, hepatic vascular retraction, visible vascular invasion, and MR reported lymph node metastasis. The VOI was drawn on 3 phases, which was then expanded to create another VOI, including a 3 mm wild pre-tumoral region. Following isotropic resembling and intensity normalization, 2,264 features corresponding to each VOI were extracted using the UAI research culture, which was developed by Shanghai United Imaging Intelligence Incorporated. The values of the features were normalized using the Z-score method, and those with both intra and inter-observer iCCA more than 0.8 were selected. The lasso with 5-fold cross-validation was used to select features to contrast radiomics models. After surgery, patients underwent regular follow-up examinations every 3 to 6 months, and the visit was extended to once a year after 5-year follow-up. Until December 2023, all patients were followed by telephone or visit records, and those with incomplete survival data were excluded. The endpoint was defined as recurrence, last follow-up, or death. Here is the clinical and image features of our patients in the training, internal, and external test set. Clinical predictors were identified by using logistic regression analysis. Intrahepatic dilatation and MR-reported lymph node status were significantly associated with lymph node metastasis. The clinical model, including these 2 features, had AUCs of 0.711, 0.738, and 0.729 in the training, internal, and external test sets. Radiomics features were selected to contrast intratumoral and combined intra and pre-tumoral radiomics models. And we can see the combined model yield a higher AUC than the clinical model and the intratumoral model in the training, internal, and external test set. And it was considered as the best performing model. So our nomogram was developed based on the response of the combined model. Intrahepatic mutation and MRI reported lymph node metastasis. The AUC of the nomogram was 0.946, 0.913, and 0.859 in the training, internal, and external test sets. The model was well collaborated with a good fit and demonstrated net benefit. The AUC of the nomogram was significantly higher than that of the combined model in the training set, but differences were not significant in the internal and external test sets. After median follow-up of 12 months, the survival analysis was carried out in 191 patients. Patients at higher risk of lymph node metastasis based on the nomogram had lower recurrence-free survival and overall survival. The Cox regression analysis confirmed that high risk of lymph node metastasis was an independent factor for unfavorable clinical outcome. In conclusion, this study showed an externally tested nomogram for lymph node metastasis prediction using both intra and pre-tumoral features. And these findings had not been reported in previous works exploring iCCA radiomics. The nomogram may have potential to enhance prognostic accuracy, guide treatment planning, and ultimately improve patients' clinical outcomes.